There's increasing evidence of the healing power of music for some neurological and mental health disorders.
What we found in our own studies is that across the board, you can almost count on music to improve mood and reduce anxiety, as well as improve other mental health-related outcomes.
It breaks that trance of grief, and it gives you windows of serenity. So even if it's only for a moment, you know that you are capable of feeling good again. That is a really, really powerful medicine.
Discover music as medicine inside this edition of CTSI Discovery Radio. Welcome to CTSI Discovery Radio. I'm your host, Brian Belmer. CTSI Discovery Radio is brought to you by the Clinical and Translational Science Institute of Southeast Wisconsin. The CTSI is a consortium of researchers, doctors, scientists, and others representing 8 institutions, including the Medical College of Wisconsin, Milwaukee School of Engineering, Marquette University, the University of Wisconsin-Milwaukee, Children's Wisconsin, Froedtert Hospital, Versity Blood Center of Wisconsin, and the Zablocki VA Medical Center. The CTSI works collaboratively across all of our member institutions. Our mission is advancing health through research and discovery. When we think of treatments or therapies for a disease or a disorder, we commonly think of pharmacological drugs that are swallowed or injected or devices implanted to provide better outcomes. But today, we're about to discover some amazing therapies that are utilizing the power of music as medicine. First, we hear from Dr. Alexander Pantelyat, Associate Professor of Neurology at Johns Hopkins University School of Medicine and co-founder and director of the Center for Music and Medicine at Johns Hopkins University.
Our vision can be summed up with a dual motto of music as medicine, medicine for musicians. In relation to that, our dual mission is to make music and rhythm an integral part of treating and healing various illnesses. And the other aspect of the mission is to help create a new subspecialty of performing arts medicine for musicians.
He breaks this down into a couple of components.
First part is using music and rhythm to treat and heal patients with a variety of neurological and non-neurological illness, to integrate music and rhythm into the everyday care that we provide for patients, both at the hospital and as outpatient.
And the other aspect of the center's dual mission is to
care for musicians around the world, to provide world-class clinical care, because they require unique assessments and unique treatment management decisions. And that specialty of performing arts medicine doesn't yet exist, and we're trying to change that.
Next, Dr. Pantelyat shares some background on the Center for Music and Medicine's formation.
We were founded in early 2015. From the beginning, it was a collaboration with the Peabody Institute, our School of Music here at Johns Hopkins. And my co-founder was Sarah Bashtepi-Gray, a multi-talented guitar faculty at the Peabody School, and is at the same time an occupational therapist. She splits her time between teaching guitar and being an occupational therapist with a specific focus on ailments that befall musicians. That includes singers, dancers, as well as instrumentalists.
As for how he himself came to co-found the center, he reflects on a conversation from 2013.
When I was interviewing for my current position at Johns Hopkins in the Department of Neurology, the chair of neurology asked me a question during the interview, which was, if you had your ideal professional setup, what would that look like?
Dr. Pantelyat was ready with an answer.
I said, I'd love to blend my passion for neurology with my passion for music.
Because, you see, his passion for music runs deep and wide just like his passion for neurology.
I've been playing violin since I was 7. I began in the Ukraine and moved when I was 9 to the United States, grew up in Philadelphia, where I was lucky to be on scholarship at the Settlement Music School, and then proceeded to continue my violin studies with a private teacher in Philadelphia.
Enriching his life through music, including experiences playing with
the Philadelphia Youth Orchestra. Then when I went to college at the University of Pennsylvania, the Penn Symphony, got to travel with those orchestras, and these were really some of the formative experiences of my life as a musician.
In fact, growing up, he loved playing the violin so much.
When I was in high school, I seriously considered going to conservatory. Ended up taking a safer road, especially if you consider the career of a classical violin soloist. Just not that many people make it.
So instead, he prioritized his medical studies over music in becoming a
third-generation neurologist. Both of my grandmothers, my mother practicing neurologist. I went, I guess, into the family business.
But all along, his passion for music was still always right there.
It's been my solace, my respite, my stress relief, all throughout my medical training, certainly now as well. Whenever I'm having a tough day, that's what I turn to. That's what violin music more broadly means for me. So I want to share that with people around the world as we have increasing quality of scientific evidence showing that music can actually help relieve the symptoms of many conditions.
Back to that 2013 conversation, Dr. Panteliot was encouraged to explore both his passion for medicine and music.
He said, well, why don't you reach out around Johns Hopkins and see if you have like-minded people who would be interested in doing this work, who maybe already are involved in this work. And so the following 6 months or so, about 80 people from around Johns Hopkins University, that half of them probably at Peabody, most of the rest from the School of Medicine, but also the undergraduate campus in different schools around the university had responded with interest.
Leading to the formation of the Center for Music and Medicine, a highly collaborative effort.
Either on the treatment of musicians side, so we have several otolaryngologists who specialize in the treatment of singers and their illnesses and occupational injuries. On the flip side, we have people in the lab, we have people doing clinical research who are interested in the use of music and rhythm to treat various illnesses, both in the Department of Neurology, which is where the center is formally located, but also now increasingly collaborators outside of it. And it was clear to me Hopkins was the right place to do this.
He feels fortunate to be able to move forward in melding music and medicine.
We had our initial meeting in early 2015 to kick things off, and this initiative has just really developed, I would say, organically. And so we've been very fortunate to be able to hire staff and move our work forward to fulfill our dual vision and mission.
What specific diseases does the center focus on in utilizing music as treatment or therapy? As for Dr. Panteliot himself,
I'm a movement disorders neurologist. I have training in the management of Parkinson's disease and related disorders and other conditions that impact movement, but also cognitive function. So I have training that allows me to evaluate and treat patients with a wide range of mostly neurodegenerative conditions like Parkinson's disease and Alzheimer's disease. And that's really, for the most part, been the focus.
However, more recently, some of his collaborating cohorts have been focusing on
expanding both the clinical music therapy services around Johns Hopkins Hospital, and that's led to some interesting collaborations which are now becoming research studies.
For instance,
we're partnering with our neuro-oncology colleagues, and we are doing a music therapy studies on patients with glioblastoma, which is a very aggressive type of brain cancer. And we're looking at whether using music therapy in addition to the standardized treatment regimen, which includes chemotherapy and radiation, can meaningfully change outcomes for these patients.
There's also work being done with patients who have suffered severe strokes or traumatic brain injuries.
We are providing music therapy consultation services, but ultimately what we want to do is see if the music can actually probe consciousness for patients who don't appear to have much of a response to a regular stimuli during a neurological assessment.
So for patients who have suffered a grave brain injury,
up to a quarter of those patients may have what's called covert consciousness. studies that have been done show that if you talk to these patients, you ask them, for example, tap your fingers, move your toes, and they don't do that, they still can have the kind of brain activity in functional MRI or EEG that indicates that they're actually sending the signals from the brain. They understand what's being asked of them, and they could actually create the signals at the level of the brain.
Thereby leading to the question,
do they have a better prognosis, a better chance of eventually recovering compared to those who don't have those signals? And if so, can music be used to activate them, to probe whether patients are more likely to have this residual consciousness? In other words, music as a helpful diagnostic tool. At the same time, can you use music, familiar music in particular, to improve people's consciousness and help bring them back from traumatic brain injury?
Can music impact both our body's neurological and physiological functions, or does music mostly benefit neurological function?
Great question. There's been a lot of research focusing on neurological function and mental health. What we found in our own studies with patients with neurodegenerative conditions is that across the board, you can almost count on music to improve mood and reduce anxiety, as well as improve other mental health-related outcomes.
Dr. Panteliot uses this example.
In hospitalized patients with psychiatric disturbances, music may improve aspects of psychotic behavior, and in patients with Alzheimer's disease, especially more advanced disease where there are behavioral issues, music can help calm and relax patients and often improve bothersome behaviors.
But, he adds,
there also is a lot of evidence outside of neurologists. For instance, there is a lot of evidence that patients undergoing various surgical procedures, both under general anesthesia, under twilight, if music is played in the operating room, the outcomes seem to be better. Playing music seems to do something.
The question is, playing music for who?
If we're talking about music being played in the operating room, is it the patient that's directly receiving the benefit, or is it that the surgeons are doing a better job of operating because they're enjoying what's being played? And the answer is perhaps a bit of both. But the question, of course, from a research perspective is, do you have the patient select the preferred music, or is it the surgeon that should select the music that they enjoy? So we still have to do more work to clarify that.
When considering music as medicine, Dr. Panteliot says there's an important distinction to be made.
What we're talking about today are music-based interventions, or MBI. Music-based interventions can be divided in two groups, music medicine and music therapy. Music therapy is a kind of music-based intervention delivered by a licensed music therapist. Music medicine is everything else. A nurse offering a playlist for a patient is music medicine. My going in my own patient's room and playing the violin is music medicine.
And the ability to objectively measure how and how much music can benefit patients has advanced in recent years.
Beginning in 2019, was specific funding at the NIH allocated towards music-based intervention studies. This continued since that time, and that, of course, has raised the profile of the field and led to some very innovative work continuing to this day. So the fact that the National Institutes of Health recognize music-based interventions have promise from a scientific standpoint in measurable ways is a real shot in the arm for the field, and that's been a big reason why there's been a lot more work and awareness about it.
To date, what exactly is known about music's impact as medicine, specifically for our brain and brain activity?
Just listening to music can activate multiple parts of the brain at the same time. In fact, there are multiple interconnected regions of the brain that form networks that serve specific functions activated by listening to music, playing music, or singing or dancing.
However, considering the subjectivity of music,
I want to make an important point here that one size does not fit all when it comes to music-based intervention. So what I'm saying is that for people who have intensely pleasurable associations with particular songs, with particular types of music, they will have a powerful, positive activation in the emotional processing network. But other songs may elicit very negative activation, so we have to be very careful when selecting music for music-based intervention research.
Which is why, at the Johns Hopkins Center for Music and Medicine,
we call it precision music medicine. What I mean by that is we need to individualize pieces of music that are being delivered for treatment purposes for the patient, because we certainly first want to do no harm, And secondly, we want to really optimize the response, particularly the emotional response to the music, which has a lot of positive downstream effects.
He shares one of these positive downstream effects.
If you are repeatedly exposed to music that you really enjoy, that activates the emotional processing network, you have, in a sense, a habit that you could form over time. And so that could reinforce a lot of positive behaviors.
But this also presents challenges, considering
much of the brain is activated by hearing a piece of music simultaneously. Makes it very difficult for us to separate the networks that are being activated. But we might want to only focus, in the case of our Alzheimer's disease study, on the episodic memory network, which is the network that's devastated by the disease. That's very challenging to separate, so therein lies a simultaneous promise, but also the challenge.
Do music genres have different levels of healing impact? I mean, does Beethoven have more healing impact than, say, the Beatles?
The answer is we don't know, and it depends. We don't know because much of the work so far has focused on Western classical music, so we simply don't have enough of an evidence base when considering music from around the world, right? You have to individualize the music, and you have to take cultural preferences and background of the patient into account. So the answer is we don't know for sure. It really depends on the specific scenario.
As a musician himself, what's Dr. Panteliot's favorite aspect of how music impacts and inspires medicine?
For me personally, being able to listen to my favorite music and being able to play my favorite pieces on the violin brings incredible stress relief, a sense of calm, a sense of focus, and it ultimately brings me immense pleasure. It's kind of like a dopamine hit, you know? For me, it's a sort of drug, and I know that's the case for many other people.
If you want to explore more about Johns Hopkins University's Center for Music and Medicine,
please go to our website and please feel free to email us, jhmusicmedicine@gmail.com.
Finally, just as there may be styles of music that interest you, that music may serve as medicine for you.
You can listen to music that you enjoy more easily than ever. You can join a community choir. You could join a community dance group. These are just a few examples of how music can enhance well-being, but that's what I would recommend for anyone who's considering making music a bigger part of their lives.
And as you may have guessed, yes, that's Dr. Panteliot beautifully playing his violin. Just as music can be medicine for our neurological health, it can also provide positive impact and outcomes for patients with mental health challenges. No one understands this better than Patrick Nettesheim, founder, president, and executive director of Music Success, a nonprofit organization harnessing the power of music to provide therapeutic benefits for military veterans and first responders living with post-traumatic stress and other mental health conditions from their service to our communities. Patrick shares that his own personal interest in music began
like 2 or 3 years old, listening to the music my mother and dad listened to. I also recall being fascinated by the written note. And I started learning how to write a treble clef and all these sorts of things. I'm like 3 or 4 years old, and that really got me excited into creating my own music.
Which progressed when he began learning how to play guitar.
Banging on my dad's old acoustic guitar about 5 or 6 years old, knowing that's what I wanted to play, but not really having access to lessons. And then my first lessons were when I was about 13 years old, and that's when I started my first band, playing out original music.
It wasn't long before Patrick turned his passion for playing guitar into his profession. First, as a teacher.
I was teaching about 15, 16 years old. I found students that were a year or two younger than me, and I just made sure I stayed a step ahead of them in my musical knowledge and prowess.
And then, as a professional performing musician.
Started playing regular gigs when I was a freshman in high school. As far as paying shows, I think that happened when I was in my senior year in high school, so that's technically when I became professional as a performer.
Patrick quickly realized his musical ability meant more than simply making money. In fact,
early early on, playing guitar really was my refuge, my sanctuary, the connection to the divine. I know you're a musician too, Brian, if your listeners don't. Very excellent. Whammy-nominated singer. What I found was it was a great way to express myself, manifesting feelings in a way that ideally you can touch others with and they like it. It gives you self-realization that you're not alone in this world. And that's why I think people who aren't musicians gravitate towards music, because it speaks to them and they're able to feel common emotions and know that they're connected to something greater.
Realizing the connectivity and therapeutic values music offers, he acted upon this discovery.
I started noticing that it was something greater than just how it affected myself when I started teaching guitar in greater numbers right after college. And there was a period of time where I was teaching 60 to 70 students a week. I saw how students would come in, we'd play a little bit, and then they would talk.
Patrick saw these conversations were just as important to the learning process as the playing, although
at first I felt like, man, I'm charging them to sit and have a conversation, but I realized from an educational standpoint, you're not going to do really well in absorbing the content if you got a lot weighing on your mind, heart, and soul. It can be a real challenge to learn. So the guitar, for me and for my students, was the catalyst for positive human interaction, because it became a common point for them to feel with that guitar sitting in the center of their being, and fortunately safe with me to talk about things. So it wasn't as much as playing the music, but just having the music part of that whole formula.
He gives another non-musical example of this same principle.
We even do that. We go out for some coffee. Why do we do that? Is the coffee the social lubricant, would you say? Or is it the common enjoyment? We feel comfortable with it, and now we're sitting at the same table, and we can have that direct communication, sharing of thoughts, emotion, and gives you reinforcement that, everything's going to be okay.
Then, one day, a guitar student referred to Patrick really brought the healing power of music into focus for him.
We had talked on the phone a bit, and he said he had a disability, post-traumatic stress disorder. I didn't know a lot about it at the time, and I said, I've never turned away a student because of their struggles. Come on in, and I don't think this will get in the way. The instrument being that catalyst, setting the stage for the human interaction. That's exactly what it did. Dan was a Vietnam vet, and he wanted to know what it was like to make it as a musician. So those were the beginning of the conversations while he was learning how to play guitar chords and some music.
The therapeutic benefits of playing the guitar were instant and evident.
Dan told me that when he was strumming the chords, he was able to break the trance of grief. That grief hangs heavy. It's physical. You can feel the grief in your chest, in your head.
But holding a guitar,
you're incorporating both hands, you're hearing the notes, you're feeling it vibrate. It breaks that trance of grief, that obsessing that happens through the recovery process. And it gives you windows of serenity. It opens that up. So even if it's only for a moment, you know that you are capable of feeling good again. That is a really, really powerful medicine.
And from that teacher-student relationship grew a friendship and then a business relationship.
Dan shared with me how positively impactful it was on his life, and he wants to share this with other veterans to help them on their journey.
Through the local VA hospital, Patrick and Dan co-founded an organization providing free guitars and guitar lessons for other military veterans suffering from PTSD.
So in June of 2007, I looked at Dan. I said, I'm a musician. I'm really good at not making money. Let's start a nonprofit. And we did. Guitars for Vets.
Over the next 17 years, Guitars for Vets grew to a scope of
150 chapters throughout the United States and affiliate chapters that I advised on in the UK and in Australia.
But despite his phenomenal success, Patrick felt compelled to offer help beyond only guitars and veterans.
For many years, I just thought, man, this could make such a difference if we could scale this to reach more folks and add more instruments, not just guitar, but bass guitar, keyboards, drums, vocals.
Resulting in his latest success, Music Success.
So music, the number 6, the letter S.
With Music Success, Patrick aspires to help more people through broader musical means.
We create music-inspired communities that support humanity. With this in mind, we focus on military vets, firefighters, law enforcement, and medical professionals.
But for anyone who isn't a military veteran or first responder,
somebody comes to us, they feel they could benefit from this program, they can also join.
It's early stage, but already Music Success has achieved a level of success.
People are saying, this has saved my life. Now I'm telling them, you saved your life. If we inspired that, well, thank you.
And speaking of stages,
with our Goodwill modeled music store, we have a stage. We feature performers every Thursday night. The general public, as well as first responders and veterans, are finding a home within the Music Success community because they're able to share that common bond, and that is music.
To this point, Music Success has not been part of any clinical research. However,
I would absolutely welcome clinical research. We know it works. I've been doing this again for 18 years with veterans and now with first responders. We see it all the time. However, I also really love science, and I would welcome that.
Plus, they're well positioned for research.
We have a methodology, and we have subjects that are more than willing to be open and honest about their experiences with this.
Also, Patrick has previous research experience.
With Guitars for Vets, we did research, and what we ran into, that was a real struggle in trying to get it published because the results were so good, people didn't want to believe it. This is why we need clinical research.
So, what is it about music that makes it vital for our well-being?
It's really important for humanity to belong. People have a need to connect with other people. Whatever the reason for it is part of who we are as a species.
If you want to learn more about Music Success,
our website is music, M-U-S-I-C, the number 6, the letter S.com, Music 6S.
If you're a veteran or first responder who might benefit from Music Success,
this is a program that is free. You don't have to pay a penny to get your free instrument and your lessons.
Even if you think you have no musical ability, you can have success with Music Success.
The music is secondary to the healing that can be found on the journey. It's not an academic study of playing this instrument. It's cultivating everything that's good within you through this interaction of learning and feeling a sense of accomplishment, which would be even more important for those who feel they can't play and suddenly they are.
And that's Patrick playing his guitar for us. We're all out of time for this edition of CTSI Discovery Radio. As always, thanks to each of our guests for appearing on today's show. Dr. Alexander Penteliot and Patrick Nettesheim. I hope you've discovered something by listening to today's show. And I'm doubly hopeful you'll join us again next time. CTSI Discovery Radio airs the third Friday of every month. Make an appointment on your calendar and join us for each episode. On behalf of the Clinical and Translational Science Institute of Southeast Wisconsin and all of our affiliate partners and members, I'm Brian Belmer, wishing you happier, healthier days ahead. For For more information about research or to listen to the podcast of this or any of our shows on demand, please visit our website at ctsi.mcw.edu. CTSI Discovery Radio is written, produced, and hosted by Brian Belmer in collaboration with WMSE Radio. The CTSI and this program are under the direction of Dr. Reza Shakir.